everyone. Welcome back to the 13th episode of the Doctor's Discoveries. I'm Ellen.
I'm Serena.
I'm Shanti.
And I'm Sharvi.
And today we're going to be talking about cryotherapy, which is basically a procedure that uses a cryoprobe, which is cooled with substances such as nitrogen, liquid nitrous oxide, or compressed argon gas for extremely cold liquids, or an instrument. Again, the cryoprobe is used to freeze and destroy abnormal tissue. It is used to treat types of cancer and conditions that can become cancer. Cryotherapy is also called cryoablation and cryosurgery, where cryosurgery is an instrument with a nozzle which sprays carbon dioxide or liquid nitrogen to freeze off and therefore destroy abnormal tissue that is disrupting the body. Doctors use cryotherapy because it is most of the time minimally invasive and it is done without open surgery and people recover quickly with little pain. In general, cryotherapy is recommended for people with bone cancers, retinoblastomas, which is a retina cancer found in children, people with warts, skin tags, or dark spots, people with cervical cancer, liver cancer, or prostate cancer, and also people with early-stage skin cancers. External cryotherapy is also a very common tool, cryotherapy is the most common, which I've been talking about previously, but internal cryotherapy is also used. This is where the cryoprobe is inserted through a small incision in the skin and an ultrasound imaging could be used to guide the cryoprobe to the tissue. Some local or general anesthesia can be given depending on the location of the abnormal cells, where the treated area after having cryotherapy will probably turn red and blister after treatment or form into a scab. Now, Serena will talk more about the background information of cryotherapy.
Modern whole-body cryotherapy was developed in the late 1970s by a Japanese rheumatologist, and his original purpose was to treat rheumatoid arthritis and reduce joint inflammation and pain without heavy medication. Early cryotherapy chambers were medical-only, large, expensive, and hospital-based. They used cold chambers reaching up to negative 110 degrees Celsius to negative 140 degrees Celsius, which was really cold, and the practice spread from Japan to Europe to the U.S. and shifted from medical treatment, and now it's more for wellness and sports recovery. And modern advancements include smaller commercial chambers for gyms and wellness clinics, cryotherapy chambers, and localized cryotherapy devices for injuries and rehab. Today, cryotherapy is marketed more as a lifestyle and recovery tool than a medical treatment. Research is still ongoing, but regulations vary from country and region and states.
Okay, so the way that it works is a doctor sprays or swabs liquid nitrogen onto a targeted area, or also uses a cryoprobe, which is goes into your body. And although you've probably heard liquid nitrogen is really dangerous when it comes into contact with skin, but doctors can utilize it in minimal ways and so that it's not completely unsafe. And basically this liquid nitrogen freezes the skin cells and causes a scab which falls off. The reason why it works is because after your body leaves the cold environment or it warms up again, blood flows back to the limbs or the targeted area, and it brings a rich supply of resources prepared by the body to combat the emergency situation. So it kind of just helps you recover and boost your bodily systems fast.
Also, a little more detail about how the ice crystals form inside of the cells. So basically, after a spot is frozen, ice crystals are going to be forming inside of the cells, and then these crystals rupture the cell membranes, which, like Shanti mentioned, it disrupts the blood flow to the area, and that basically cuts off the cell's ability to function or repair itself. And then over time, the frozen, damaged cells die, and the body's immune system just clears them away. Also, there's this thing called internal cryotherapy, which is much more precise, and it's where a thin needle-like instrument called a cryoprobe is inserted through a small incision in the skin, and then it's guided to a target tissue, which uses imaging ultrasounds or CT scans, and basically an extremely cold gas flows through the probe, and it creates this ice ball that surrounds and freezes the abnormal tissue while minimizing damage to nearby healthy cells.
Which I also talked about before, but Sharvi is expanding on.
Okay, so one example of how it can be used is to combat cancer. And like Sharvie just talked about, it uses extreme cold to kill cancer cells while the normal cells remain unharmed because it's minimally invasive and it's good for early stage tumors and often used for prostate or skin cancers. So, like we said before, the doctors expose the area to liquid nitrogen, and since freezing tissue causes the water component, which is a huge part of tissue and like your body in general, to expand, it squeezes and damages cells and it leaves them dehydrated and shrunken. And so those cells, which are usually the cancer cells, like die, and then they like either become a scab or like just like leave the body as waste or fall off. And so basically is a good way to get rid of cancer in the early stages, but scientists are not exactly sure if it helps with like getting rid of it for good or if it might come back in the future.
Also, like Serena was mentioning, there's like a difference between medical cryotherapy and then also whole body cryotherapy. So like whole body cryotherapy is like the wellness trend recently, and it involves standing in a chamber which is filled with ultra cold air, which is sometimes colder than negative 148 degrees Fahrenheit. And you stand there for 2 to 3 minutes. And athletes and wellness centers promote it for muscle recovery, reduced inflammation, improved sleep, and mood enhancement. And some studies also suggest that it may lower inflammatory markers and reduce pain in conditions like arthritis or chronic back pain. But still, research is still ongoing, and the long-term safety and effectiveness aren't fully understood.
So some pros and cons. So the pros would be there are commonly reported benefits including reduced muscle soreness and inflammation, faster athletic recovery, temporary pain relief, and short-term mood boost due to endorphins that are being released. And they're also popular among athletes because the sessions are quick. There's no physical exertion that is required. And some users even report that their sleep improved, they had increased alertness and reduced perception of stress. But there are some cons, which are that scientific evidence is mixed, especially for long-term benefits, and there are risks that include frostbite or skin burns if they're improperly administered. There are breathing issues for people with asthma or heart conditions. They're also not FDA approved as a medical treatment for most claims. And it's also extremely expensive, or not extremely, but it's expensive for the normal person because sessions can cost around $40 and up to $100 for each session. And critics argue that benefits may be comparable to ice baths, and there's a lot of placebo effect. Okay, so I think that wraps up today's episode. I'm Serena.
I'm Sharvie.
I'm Shanti.
And I'm Ellen. Just a disclaimer, this podcast is made, created, and researched fully by high schoolers, so not everything we say is 100% correct. Thank you for listening.